All right, for a blood flow restriction setup, we want to put the cuff as high up on the arm or the leg as we can. And then to get an accurate reading, we need a patient to lie down. So if you can lie on your back, please. Lie on your back, yeah. All right, yep, keep the arm relaxed. And then from there, the machine, it has a Doppler inside, so it's going to give us an occlusion pressure that is going to block 50% of her arterial blood flow going down the leg and 100% of the blood coming back up. The blood vessels in the leg are a little more durable, so it actually blocks 80% of the blood flow going down the leg and still 100% of the blood coming back up in the leg. So we'll get a reading that is not her actual blood pressure, but it's the level of occlusion that we want to get the parameters I just described. So that's our reading. And then if you lie on your side, please, left side. 1 pound, yeah. And that felt pretty good, I'm assuming? Yeah, all right.
Very good.
So then from here, we can give her a weight that's about 20 to 40% of her 1 rep max and get the benefits of doing a weight that's about 80% of her 1 rep max. She's going to do a protocol called the 30-15-15-15 protocol, which is basically 30 repetitions followed by 30 seconds of rest, and then 3 sets of 15, each with 30 seconds of rest. So we can always manipulate and change the exercise, but that protocol stays the same every single time. And as part of the research and the advancement done when developing this technology, they played around with lots of different protocols. Pretty much every single time this one protocol came back as being the most effective. So. It's not painful, definitely a little uncomfortable, but basically just feels like a blood pressure cuff's been on your arm for a while. But even though she's got a little 1 pound weight, it feels like something much heavier from the lack of blood flow to her muscles.
Okay.
All right, so we'll press the screen. It gives us a 30-second timer for her first break.
Would this be beneficial for patients that went through a ruptured tendon surgery?
It would. So one of the benefits to this is a lot of times after big tendon or muscle ruptures, we can't lift heavy weights for a certain period of time while the muscle and the graft heals. So for example, a rotator cuff, a shoulder, you're up for the next set. You can't lift more than 5 pounds for 3 months. So with something like this, we can give someone a lighter weight, still get a lot more strength and muscle size back in the muscle than we could without this technology, because we'd be so limited by those loading precautions. So rotator cuff repairs, biceps tendon ruptures, Achilles ruptures, ACL reconstructions, total knees, total hips, they're great for all those surgeries. You're just doing 15, right? And then, what are the reasons why we have this device? This device is the only device approved by the FDA that's approved as a medical device for blood flow restriction. The fluctuating numbers are always changing because there's a Doppler inside that always maintains the exact level of occlusion that we want. So the safety and efficacy of this device is unparalleled compared to a lot of other devices that are on the market.
Say they come in, how long would you put this on in their protocol until they actually got to off the machine and into free weight training?
All right, that's a good question, because when someone has a certain baseline level of strength, this device is ineffective for ongoing strength. You need to give someone weights after that. So, I'd say, let's say an ACL reconstruction, a rotator cuff repair, I'd probably use it for the first 3 months where we have a lot of those initial loading precautions. And then from there, the device is ineffective to increase strength. You just have to progress to heavier weights. However, you can still use the device for people that have decent strength, but still have pain, whether it's from tendonitis, a small muscle tear, because the recovery and restorative environment that's created in the tissue with the release of these different beneficial hormones to help healing can still be beneficial for some of these less serious injuries, but the context changes. It's used a little bit more for recovery and healing, not so much to increase strength.